Hi guys, welcome back to my channel. I'm Abbas Ali, a full-time orthopedic surgeon, part-time YouTuber, and orthopedic faculty, national level exams. Let's look at this quiz over here. There is an X-ray given here and there's a question attached. The X-ray shows a fracture, right? Some fracture, and the question reads, a 24-year-old policeman came to the emergency following an assault. Now there are three questions. What is your likely diagnosis? What is the other name of this injury? What is the treatment of choice? Now let's try to identify this X-ray. This is an AP and lateral view of your hand with your wrist and the distal forearm. So you can see your radius over here, and you can also see your ulna over here, and this is supposed to be your anterior-posterior view. This is your lateral view, where again you will see that this is your ulna, and there is a fracture here in your radius. So the X-ray shows a fracture here in the radius and a dislocation in the ulna. Now this fracture of the radius is not at the end or the corticocancellous junction, it is at the shaft. So it's a lower 1/3 shaft of radius fracture with ulnar dislocation. What do you think this is? It is your Galeazzi fracture. Alright, so this is your Galeazzi fracture dislocation. Lower 1/3 of radius with distal radio-ulnar joint disruption. So question number 1, Galeazzi fracture. Second, what is the other name of this fracture? The other name for this fracture is your reverse Boneteacher fracture. It is also known as the fracture of necessity. Right? Fracture of a necessity is a term that is usually used for fractures that necessitate surgery, but this was the term that was originally described for this fracture. The third question is, what is the treatment of choice? The ideal treatment of choice for such a fracture is open reduction and internal fixation. Alright, that is what you need to remember. Open reduction and internal fixation. So this is your Galeazzi fracture, an extremely important X-ray for your exam and practice. So be careful how you identify the fracture. Is it the fracture of the ulna? Is it the fracture of the radius? Now there are many students who got confused because of the fact that I mentioned that the patient was a policeman. Right? Now just because the patient was a policeman and he had an assault does not mean that this was a nightstick fracture. That is a different fracture. That is an isolated fracture of ulna. That is your nightstick fracture. This is your Galeazzi fracture. So don't get confused. I'm sure I have labeled the X-ray for you properly to identify this in your exam. So that's about it. Thank you.